Greetings and welcome, everyone. Thank you for joining us today for the continuation of our second week of this year's HIV Prevention and Education Virtual Summit. My name is Kyle Shabasta, and I am the Public Programs Manager here at the Community Health Training Alliance, an education and training program of Philadelphia Fight Community Health Centers. Earlier this week, we learned about PrEP modality preferences, as well as inclusive and affirming language in care provision. And today we have a pertinent topic for you as well. But before I introduce today's topic and speaker, I just want to go over a few brief house rules. So the chat is currently disabled, but if you have any questions, please place them in the Q&A box below. We will facilitate all questions and answers at the end of today's presentation. Today's presentation is being recorded, and you'll be able to watch this one and all of our other presentations on our YouTube channel. Once this webinar is completed, just hang tight and click the link that pops up after this window closes. That will direct you to a survey. Let us know how we're doing, and we appreciate to hear from you. So, with that said, I am pleased to introduce today's topic and speaker. With us today, we have Dr. Samuela Ware. Dr. Ware is a postdoctoral researcher at Drexel University's College of Nursing and Health Professions. Her research is focused on race-based theories and social structural factors that impact sexual health and HIV vulnerability among Black men and women. Today, she will be presenting PrEP knowledge, attitudes, and use intentions among Black college students in the South. Dr. Ware, thank you so much for being with us today. And with that, the floor is yours.
Thank you. So for the people that are within the Philly area, I know that it is a little gloomy today, a little rainy, but I'm glad we're talking about a super sexy topic today, which is HIV prevention and PrEP. In particular, PrEP knowledge, attitudes, and intentions among Black college students in the South. So just going over really briefly what I'll be talking about today, reviewing some of the HIV epidemic within the South and how that affects Black youth. I'll be discussing PrEP as a prevention strategy and also discussing the disparities within PrEP use. And then going into the PrEP study with college students in the South and discussing future directions for practitioners, case managers, advocates, as well as pharmaceutical companies. And then very briefly at the end, having any questions that participants may have, we'll have an opportunity to ask and answer those questions. Before I get started, I just want to acknowledge my research team as well as my co-authors on this. I have Dr. Yarnesia Dyson, who is at University of North Carolina at Greensboro, as well as Dr. Shamika Thorpe at University of Kentucky. Also want to acknowledge our funders for this project to make this study possible. I'm not going to read off all of this, but you can go ahead and read it at your own convenience. So some background knowledge about HIV within the South. I recognize a lot of you might be in the northern region. So just giving some brief overview of HIV within the South in particular. So for Black youth between the ages of 15 and 25, they account for the highest prevalence of new diagnoses of HIV. And particularly within the South, 52% of new infections occur within the South. This disparity is compounded even more when it comes to racial disparities. So Black youth between the ages of 18 and 19 are 6 times more likely to have HIV than their white counterparts, and 11 times more likely to have HIV for Black youth between the ages of 20 and 24. So we know that biomedical strategies are effective in increasing protective behaviors as well as decreasing sexual risk behaviors for communities that are especially vulnerable and at risk, such as Black youth. But there's little knowledge known about the uptake of these prevention strategies within a college sample, especially within the South, which have a greater risk of HIV. And so I'll talk a little bit about why there's little knowledge about that in the coming slides. So for this study in particular, we wanted to look at Black college students' knowledge, attitudes, and intentions to use PrEP which is a biomedical intervention for people who are HIV negative, but at risk for HIV. At times, college campuses or college students are kind of not viewed as a vulnerable population. They're at times viewed as a particularly privileged population. So I thought it was important to kind of focus in on why a college campus is unique. So for some people that know about the fun times of college, you know, this is your first time being on your own, being the one responsible for making decisions when it comes to your relationships, and what you engage in, without your parents or caregivers being able to watch over you. And particularly for students that are impressionable, they can be at risk for sexual risk behaviors, alcohol use, and drug use. And research has found that although a majority of college students are actually sexually active, only 35% report using consistent condoms. And the HIV burden, particularly within HBCUs, is astounding. So 80% of the counties that have higher rates of HIV are also the same counties that house HBCUs. And for studies that have used HBCUs as a setting, they found that Black college students perceive their risk to be low, despite having unprotected sex with multiple partners and being unaware of their partner's sexual health history and their partner's HIV status. Also, Black students tend to pick sexual partners that are within their same racial or ethnic group. So for a lot of people, it could be the fact that Black students are available on campus, especially with a historically Black college. And not only do they engage in sexual behaviors with other students within their campus, they also engage with sexual behaviors with the locals that are relative to the campus community. And it's also important to note that although college students are seen as a different population or a less vulnerable population, the general public and college campuses are actually reflective of each other. So college students are in turn also vulnerable, just like the general population. So this might be a little repetitive for those that know a little bit about PrEP, but I think it's important to kind of go into the basics of PrEP. So in 2012, PrEP, which is a daily pill to prevent HIV, was approved by the FDA. And just recently in 2018, PrEP was approved for youth. So PrEP, according to the CDC, is for populations at high risk. And I provided the three groups of what they consider high risk populations. So it's people who are HIV negative that may have consistent sexual interactions with an HIV positive partner. It's also for heterosexual men and women who have condomless sex with a sex partner who they are unaware of their status, and also for people who inject drugs and share needles. However, there is a huge disparity in PrEP usage, specifically within the South. As I stated, 52% of new infections occur in the South, which is the majority of infections. However, only 27% of PrEP usage occurs in the South. And specifically with the Black population, only 1% of the Black population are prescribed PrEP that can benefit from PrEP. So the American College Health Association has actually recommended PrEP as a preventative measure to reduce HIV infections among Black college students. However, there's definitely some barriers with college students using PrEP as a preventative measure, and one of the reasons why there is not a large uptake. A lot of medical providers and research have stated that they're hesitant to kind of prescribe PrEP to college students because of this assumption that if you prescribe PrEP, then they're more likely to engage in sexual risk behaviors, which is not necessarily true within research. Those who are prescribed PrEP still make sure they use condoms when having sex. So in recent studies, it's shown that although Black college students are engaging in condomless sex and have knowledge of HIV, very few of them have knowledge of PrEP. And for adolescents in particular, they're more likely to have structural barriers than adults. So this can be cost, access, and stigma. And current research around PrEP have found that college students view themselves at a lower risk for acquiring HIV and are more likely to actually say they would use PrEP if they consider themselves at high risk for HIV. So for the current study that I'm going to be presenting the results on, it was a concurrent mixed methods pilot study where we looked at the sexual health needs of Black college students enrolled in 5 historically Black colleges and universities and a minority serving institution. And for those who are unaware of what a minority serving institution is, it is a university or a college that serves 25% or more of a particular minority group. So for this study in particular, I'm just looking at the survey data, which we asked questions about HIV knowledge, sexual health behaviors, PrEP questions, and then we asked questions about preventative behaviors. So for the PrEP questions, we provided students with a brief description of PrEP, what the purpose was, use recommendations and indications, as well as cost and possible side effects. And we did this pretty much on the basis of knowing previous history and knowing that a lot of college students did not already have the knowledge of PrEP. And for the students that completed these questions on PrEP, it was 269. And that is the sample that I'm going to be referring to in the results section. So for the sampling, we recruited students from 5 universities using emails and listservs. We emailed athletic departments, student organizations, and also academic departments, and also placed flyers in high traffic areas such as like student lounges or the common areas in dorms. And there was also a member of the research team available to do active recruiting. So that's tabling, personally handing out flyers, and speaking to students within the classroom to talk more about the study and its purpose. And for the measures within the survey, we asked demographic questions such as gender, age, sexual orientation, and their current housing. And we asked questions about PrEP knowledge. So before reading the description of PrEP, had you heard of PrEP? And this was just a yes or no response. We asked about PrEP attitudes. What do you think of PrEP as an HIV prevention strategy for yourself or your primary partner? And this was a 5-point Likert scale from like, this is an extremely bad strategy to this is an extremely good strategy. And then we asked questions about PrEP use intentions. So how likely would you be willing to use PrEP if it was available to you? So we phrased it in this way because we were only aware of one college campus that was offering PrEP in their health centers. So it would not have been readily accessible to a lot of other students at the other universities. So if it was available, would they be willing to use PrEP? And then we asked questions about sexual risk behaviors. So this was self-reported how many times they had had condomless vaginal and anal sex within the last 3 months. And then we dichotomized that into an elevated risk or a low, no risk. So people who stated that they always use condoms were placed into the no, low risk. And for the people that stated they had had 1 or more condomless anal or vaginal sexual interactions, we placed them in the elevated risk category. So our sample contained majority men, which I will say is not typically what happens within research. When men were actually targeted within this study because we also examined factors within masculinity and sexual risk behaviors. So the majority of our sample was men, which is 56%. Most of them were 20 to 22 years old, undergraduate students who lived off campus and identified as heterosexual. And 79% of them had engaged in some sort of sexual interaction within the last 3 months. On average, they were engaging in condomless vaginal sex 6 times in the last 3 months and condomless anal sex once in the last 3 months. And when I talked about the sexual risk category, 60% of them were categorized as elevated risk. So for PrEP knowledge, as previous research has shown, the majority had not heard of PrEP before we had presented it to them. There was no significant difference between genders, so men were not more likely to know about PrEP than women. But age and sexual orientation were both significant predictors. So college students that were older were more likely to know about PrEP, and also college students that identified as queer instead of heterosexual were more likely to know about PrEP. However, sexual risk behaviors, engaging in condomless anal or vaginal sex, was not a significant predictor to whether or not they had knowledge of PrEP. Additionally, 59% of them thought that PrEP was a pretty good prevention strategy. Again, no differences between gender, men and women, and sexual orientation and age this time was not a significant predictor. Again, sexual risk was not a predictor to whether or not they thought that PrEP was a good strategy. So in addition to them believing that PrEP was a good strategy, a majority of them said that they would take PrEP if it was available to them. And just like the knowledge and attitudes, there were no difference between men and women. And again, no difference between age and sexual orientation. And sexual risk behaviors was not a predictor to whether or not they would use PrEP. So why is this important? Um, for this study, we recognize that a lot of students did not know about PrEP, which is reflective of previous studies. But we also recognize that a lot of students thought that PrEP was a good prevention strategy and stated that they would use PrEP if it was available to them. So this shows that PrEP is something that can be placed in the toolbox, prevention toolbox, if you call it that, of things that could prevent HIV. And we also recognize that although our sample was elevated risk, a lot of them did not perceive a lot of them did not actually correlate with their knowledge, use, or attitudes of PrEP, which is like previous research, a lot of Black college students perceive themselves as low risk, even though they engaged in high risk behaviors. So for a lot of college campuses, they've recognized the importance of having PrEP on college campuses. So for example, Morehouse has begun to offer PrEP to their college population. And in the sense of PrEP not only being available to people who identify as men who have sex with men, but for any students that are sexually active. And this is geared towards including people who may not consider themselves high risk because they may view HIV as they may view HIV within a particular population. However, there's some social injustice that comes within PrEP. As I talked about, there's some disparities in PrEP use. And I'm not sure if anyone has seen the recent PrEP commercials. And at the very end, there's this very fast blurb about how the PrEP clinical trials have not been used in cisgendered women. So it's important to have women within clinical trials because from there recommendations can be made to prescribe women PrEP as well. And although I didn't talk about the disparities with Black women make up 57% of new HIV infections, yet are not included in these PrEP clinical trials. And I will note that some pharmaceutical companies have made a statement that they will be including women in the next phases of clinical trials. But research has shown that women consider that as an afterthought and not necessarily something that pharmaceutical companies have ensured or made sure that they are actively a part of. So some future directions. I think it's important for practitioners, case managers, people that work one-on-one with education systems to recognize how we can all kind of work together to ensure that we are including Black college students within our PrEP conversations. So as I mentioned, a lot of practitioners stated that they did not want to prescribe PrEP to college students because they believe that they would increase their risk for engaging in sexual risk behaviors. So I think it's important to have these conversations with individuals that are vulnerable and vulnerable populations, because at times marketing for PrEP has been largely focused on Black MSM. And also to consider the social and structural determinants that kind of impact PrEP usage. I talked a little bit about cost, access, and stigma, and particularly within the South, this is more evident. I think with practitioners being able to examine some of the biases that they may have inherently when it comes to sexual stereotypes, as well as educators being able to provide knowledge and education so high-risk populations um, determine whether or not PrEP is an actual feasible or good prevention strategy for them, and for people who work one-on-one with at-risk populations, being able to educate them on what PrEP is about, the cost of PrEP, and also recognizing or evaluating the sexual risk behavior for populations that believe that they are not at risk for HIV. So I think this is something that everyone on the spectrum of whether being a practitioner to being an advocate can kind of help with exposing Black youth, whether you work on a college campus or work within the general public, exposing Black youth to PrEP and the possibility of using PrEP for prevention, for an HIV prevention strategy. And then with that, I will take any questions.
Wonderful. Thank you for that information, Dr. Ware. So audience members, you have been so wonderful this week with all your great questions. So if you have a question, please place it in the Q&A box below. It looks like someone actually raised their hand. If you could actually place your question in the Q&A box, that would be wonderful. So while folks kind of think about some questions they have, Dr. Ware, what is the most surprising thing to you that has come out of this study?
So I didn't necessarily include our focus groups, but part of the study was we provided a small group of college students with an HIV prevention intervention. And in that HIV prevention intervention, we talked a little bit about PrEP, gave them in a more in-depth 20-minute information session on how PrEP works, whether or not PrEP was a good prevention strategy for them. And a lot of them stated that they had seen commercials for PrEP, but didn't recognize that PrEP could be for them. So it was very interesting to hear, oh, I've heard that commercial. I've heard that medication referred to before, but I didn't know really if I was part of that. And as I mentioned, even within the survey, I didn't know that I was considered a risk category or I was engaging in risk behaviors. So it was nice to hear their thoughts around how PrEP is marketed and how they feel excluded within the marketing of PrEP, even though they're definitely eligible to use PrEP because of certain behaviors that they may engage in.
Absolutely, and I'm happy you bring that up because oftentimes I think folks get laser focused. You know, funding and marketing kind of like sometimes dictates where the energy goes. But in that, you know, and I'm happy you brought up stigma, we can stigmatize one group and leave out another. So that is a really good point, and I'm happy you brought that up. So awesome, guys. We have some wonderful questions coming through. So one person says, great presentation. Thank you for those words of affirmation. And they ask the question, what are your thoughts regarding outreach methods, strategies to this population?
So for Black youth, I had the opportunity of being part of the research team that actually handed out flyers and had conversations about sexual risk behaviors and sexual health. And I think, like I mentioned, they did not feel included within this, or at times youth in general, adolescents may have this like Superman, superwoman complex. I'm invincible, I can't get this. So I'm not a big fan of scaring people and saying, you know, you're more at risk for getting HIV, but providing them with education so they can determine their own risk. So being able to provide them with information, as in when we talked about in our prevention intervention, we discussed, hey, do you use condoms at all times? Like, of course not. Okay. So it from there, we were able to have these conversations, but I think just the knowledge, being able to provide them with that, because at times, like I mentioned, we have done not a great job of laser focusing on a certain population and not recognizing that there are other populations at risk. I talk a lot about being a person that I consider at risk as well. So I got into this work of HIV because I used to be a medical case manager, and I worked with people that looked like me, could have been me, and it helped me kind of differentiate between us and them, and recognizing I could be part of the them category. So I think for other people, it's important for them to recognize that they also can be part of the them category. And just education is very simple, just to educate them and be able to give them the tools to make the decisions on their own.
That's really powerful. Yeah. Yeah, it's really inspiring the way you engaged with the folks you're working with and the youth you were working with, and encourage them to be active participants in their care. That's tremendously inspiring. Thank you. So we have another question. Can you speak a little more about HIV and sexual prevention efforts in HBCUs?
Absolutely. So for the universities that we targeted, certain universities actually already had peer educators or sexual health educators that provided students, college freshmen actually, with one-on-one or generalized education at the beginning of their college experience. But in a sense of it being targeted, where they recognize the impact that HBCUs may have within the South, and how may have higher elevated risk. It's not necessarily something that is actively going on. So like I mentioned, Morehouse has taken the step of, being one of the people that are spearheading and making sure that they're educating their students, and also providing them with this prevention strategy. We targeted HBCUs in particular because we knew that this was not something that was an active part of their curriculum. So the HIV prevention intervention that we did on college campuses was not something that was offered to college students. So we were at times the first to do these educational programs. And it's surprising, considering, the population and the vulnerability of the population, that more isn't done for students. And I like I mentioned, I think there's always this assumption that college students, okay, they're good, they're different than the general public. But as speaking as someone that I was a professional student, but speaking of someone that has gone to college several times, I recognize my social positioning and how that is very similar to the general public. So although they are college students and they have the privilege to go to college, there are still these social structural factors that are preventing them from receiving the best care, and also putting them at risk for acquiring HIV.
Wonderful, wonderful. What was it like for you and your colleagues, feeling like you're setting that precedent, in a lot of instances?
So we got trained for this particular intervention because it was a CDC intervention. So we had to get trained in it. And the trainer was actually telling us that she had trained other people before, but no one had actually gone out and done it. So it was rewarding in the sense of being able to provide people with this education, and knowing that we were doing something that wasn't readily done on college campuses, including certain populations that didn't see themselves at risk, and providing them with that information, and also giving them a platform to talk about sexual health. Because as much as it seems that adolescents and youth talk about sex all the time, they don't really have a place to talk about sex all the time. We had focus groups that lasted up to 2 hours because they just wanted to talk about it all. They had a whole bunch of questions, and not necessarily people to connect with and answer to. So even though practitioners in the health center they're available, but that one-on-one interaction that they got from us as facilitators of the program helped them open up, and also ask questions that they may have been embarrassed or ashamed, or had some stigma around asking.
Yeah, that's great. You created that space and met them where they were, and trying to provide extracurricular learning opportunities for students who are already highly engaged in their learning is a tremendous task. So
Yes.
tremendous work. Love it. Love it. So we have a few more questions. This is a really good question. I have a daughter going to an HBCU this fall. How do I bring up this topic? How do I bring up the topic of PrEP?
Yeah, so I think, like I mentioned, the conversation is like you would have a conversation, the birds and the bees conversation, something that's not necessarily making things super uncomfortable. As a parent, talking to your child about sex is always going to be uncomfortable for both of y'all. Let's just get over that hump. But also having a conversation about advocating for themselves and their needs and prevention tools. So as I mentioned, condoms are a great thing, but also recognizing that your practitioner is not going to be the one to prescribe PrEP to you or bring up PrEP. So being an advocate for yourself in that instance. So if your child or your daughter believes that they can benefit from PrEP, having the conversation as just like you would have a conversation about condoms and other preventative strategies. Hey, this is a once a day pill that is approved by the FDA for use within your age group. If you want to learn more about it, here are some resources. Here's the website you can look at. And also, if you want to talk to your provider, primary care provider, about whether or not you would be a good candidate to be prescribed that, you can talk to your provider, but also being a resource for them as well. So if you have any questions, feel free to come to me and talk to me. If you're feeling as though your provider may not be the person, I'm always open to listen, to talk to you about this, and to engage in the conversation, whether or not it's about your sexual health or risk behaviors you may have participated in. But I think the parent interaction and the parent relationship is a great place to start. And even talking about it as a parent is awesome, because I know a lot of parents that stray away from that conversation. So being open to talk about it, I'm sure your daughter will see that openness and have an open and honest conversation with you about it.
Awesome. And thank you for that question. We have a few more. What is access to PrEP like for students in the South? In the Northeast, it's more frequently advertised now, but there seems to be a disconnect in where young people can actually access it, and even clinical staff don't seem forthcoming with much info at times. Any thoughts around that?
Yes, very, very true. So as I mentioned, only one university was offering PrEP at their college campus. So when we had our focus groups and we asked, did you see PrEP flyers at the health center? Did you hear about PrEP from your campus? No one had heard about PrEP from their campus. They had heard about PrEP from marketing commercials, and for people who actually, we had participants that actually worked within the sexual health realm. And so they had heard about PrEP that way, but the college was not the place for that education. And I think it's a really big missed opportunity, considering that college students spend most of their time on campus. So you would think this would be an opportunity for the practitioner, the health center, student health, to kind of engage with college students and provide them with that education, but it's not happening. So I don't know if it's providers not necessarily being educated themselves on what PrEP is and the recommendations for usage, or it's PrEP being fairly new as far as being approved for youth. So there's always that gap between what comes out and what is practiced. So there still may be, the gap between years where all practitioners are educated on how PrEP can be beneficial for that vulnerable population. But I really think it's a missed opportunity for college campuses to expose this vulnerable population to such a preventative and awesome tool.
Awesome. Thank you for that question. And thank you for that answer. Do you think, do you see going forward more of a push to engage students with PrEP acquisition?
Yes, I think, like I said, it's a great place because it's such a close-knit environment. And I'm not sure if anyone is familiar with an HBCU campus. It's almost family-like. So it's a great way to engage, members of your family within this. This is an entrusted environment, a safe space for a lot of the students. And they may not get that in their homes or within their community. So I think once more colleges kind of get on the bandwagon, just like Morehouse has started, this will be something that will be widespread, so they can kind of engage college students in PrEP usage, and it's not just once in a blue moon when college campus is like, hey, I want to do this. I think now that it's been approved, I think college campuses will be more likely to kind of engage students in that.
And remind me and our audience, when was PrEP approved?
2018. Oh, PrEP was approved in 2012 and 2018 for youth.
Wonderful, wonderful. Thank you for that reiteration. Yeah, and it's a perfect opportunity to kind of connect folks to PrEP. So yeah, and hopefully we get there. Hopefully we get there. So we have two more questions. It's good to hear that Morehouse has made PrEP available. Are there plans in place for the other HBCUs to make PrEP available, coupled with education? Availability of PrEP meds and education are important. Yes, they are.
Mm-hmm. So for the university that I was attending and actually was part of the sample, we're currently working with the student health, and also the reason for this study is to provide some sort of evidence to show that students don't know about this preventative tool, but see this as a good strategy. So how can we work together to ensure that the student population is exposed to this and has access to it? So what we don't want to happen is students having knowledge of PrEP and then are forced to go off campus, travel to a health center or a community center, and have to travel when they have easy access to a student health center on campus. So what we're hoping through this is the student health center can kind of be the ones to provide PrEP to the students, provide education to the students, but not on a sporadic basis like how our intervention was, but on a consistent basis. So whether it's every freshman class gets an education on sexual risk behaviors, preventative measures, including condom use and PrEP, and then be provided with some sort of guidance to ways to access PrEP on campus without the stigma attached or anything like that, then I think then we'll make some headway. But right now we're not even in the knowledge part of it. So it's still like students don't even know PrEP exists. So we have to kind of go towards like, okay, now let's educate them on the knowledge of PrEP and what it is and the side effects, the cost. And then from there, be able to provide PrEP to students on campus.
Yeah, that's a really good point. And we oftentimes talk about like the murky entry or access points to the thing, to PrEP, for instance. But I think it's wonderful to kind of lower that barrier to the entry point for just the knowledge, because starting there is like the most perfect spot. And then you can create a clear entry point to accessing PrEP. So yeah, that's tremendous.
And I think it's important to also note that within the South, the transportation is not like how it's in Philly. You can't just like wait on a bus every 15 minutes to go downtown. So if you don't have any form of transportation, it's very difficult to get to these places outside of campus. So being able to provide these resources on campus where you're eliminating some of these barriers that are already, there's definitely a lot of barriers for Black students, but eliminating some of those barriers so it's easy access, and then being able to promote health equity, because as I mentioned, there's a huge disparity between the people that are using PrEP and the people that are not using PrEP. So trying to close that gap, so the people that are most vulnerable are able to have access to the needed prevention tools.
Yeah. Geography, that is a really great reminder, because geography is absolutely part of meeting people where they are. You can't meet them where they are if there is barriers in transportation. As much as we dog SEPTA, it gets you to where you have to go. So that's a really, really helpful reminder, and thank you for that. We have one more question. What would you suggest as a valuable resource for college freshmen?
So I think the American College Health, they have a nice little template of recommendations for PrEP. It's recommendations for students and practitioners. I will have to provide the link at a later time, but it goes into depth of how to talk to students about PrEP. But the CDC is always a good resource for just basic knowledge about PrEP. And then from there, I think speaking to your practitioner, if you feel as though your practitioner may not have knowledge about PrEP, which may be the case, being able to find a practitioner that has some sort of knowledge around PrEP. I always say you have to shop around for providers at times nowadays. So making sure you're with a provider that can be able to understand the benefits of PrEP, and also understand your rationale or your case for wanting to engage in use of PrEP or learn more about PrEP.
Absolutely wonderful. Dr. Ware, this was tremendous. This was rich with information and calls to action in regards to kind of engaging with youth. So thank you for this. Before we close out, do you have any closing thoughts for our audience?
No closing thoughts. I will provide my contact information if you do want to contact me. I do feel as though, like I stated, it's an unfortunate disparity between PrEP usage and the people that are actually using PrEP. And we even see that with the ongoing COVID vaccine. So it's important, I think, to kind of close these gaps between these health disparities and engage populations most at risk and most vulnerable for these prevention strategies. And recognizing that no matter where you are in these like touch points, that there's ways to advocate or ways to ensure that these vulnerable populations have access to what they need to close these health disparities when it comes to HIV.
Thank you so much for that. And folks, take a look at her info, write it down, and reach out. This was tremendous. To our audience, thank you for being wonderful as always. Thank you for taking care of us, the presenters and hosts, and glad you stayed with us and listened. So, stay tight, hang tight, take the brief survey after we're done, and just let us know how we're doing. And to the folks saying thank you in the Q&A box, thank you.
Thank you.
Dr. Ware, have a wonderful weekend. And to everyone joining us in Philly, stay dry today. See ya.